What are we going to do when the hospitals close down? Like, what are you and I going to do when the rural hospitals close down? Right now, 10 Virginia hospitals, some in Southwest Virginia where I'm at, are at risk of shutting down. In the United States as a whole, 400 hospitals are at risk of shutting down due to Medicaid cuts in the One Big Beautiful Bill Act. What are you going to do when there's no hospital, there's no ambulance, and the nearest hospital is 30 minutes to 2 hours away? What are we going to do? What we're facing in Appalachia, it's not new. This is Appalachian history repeating itself. This is a battle that people here have been facing for hundreds of years. In the late 1800s, early 1900s, most Appalachian communities didn't have hospitals at all. People relied on midwives, home care, whoever in the community had experience. And you had a lot of older women called granny women or granny healers, and they helped to take care of the people of the community. But what happened when someone was seriously hurt and they needed a hospital? They had to be transported miles on wagons. Later, they had to be transported by truck, sometimes by train, just to reach the nearest doctor or hospital. That distance was huge because in emergency situations, time is survival, and a lot of people didn't survive. By the mid 1900s, small local hospitals started opening in Appalachia. A lot of them were tied to the coal camps, churches, local governments. Here's the pattern in Appalachian history: when industries decline, populations drop, and funding shrinks. Those hospitals still there struggle. When they close, three things happen. First, emergency response times increase. Ambulances have to travel farther to reach people. Second, routine care just disappears. Things like prenatal visits, chronic illness management, basic diagnostics, that becomes harder for people to access. Third, communities start shifting back towards older systems of care, more reliance on home care, informal support networks, folk medicine, delayed treatment. That is the structure of Appalachia's response to limited access to hospitals. If you see headlines in your area of Appalachia about hospitals at risk of closing, that is basically Appalachia returning to former models of care that people have already lived through. Historically, that model's not great, and it comes with really serious consequences for people's health.